Hi, hello, welcome to the Agni Nursing Academy. Myself, Gangaram, currently working as a nursing officer in AIIMS. In this session, we will discuss some important MCQs which is very helpful in our upcoming NORCET, RRB, ESIC and other nursing competitive examinations. We will see first MCQ. First MCQ on your display. A 6-month-old infant is brought to the pediatrician for the routine well baby checkup. The physician conducts through a physical examination, paying a special attention to the fontanelles, the soft spots on the infant's skull, and the parents, eager to understand their child's development, ask which of the fontanelles is the last to close. Option A, posterior fontanelle. Option B, mastoid fontanelle. Option C, anterior fontanelle. And option D is sphenoid fontanelle. Before going to this MCQ answer, we will see what is meant by fontanelles. Fontanelles means it is a wide gap between the suture lines. A wide gap between suture lines. What is meant by suture lines? Where is it present? Sutures are present in fetal skull. Suture means a joint between the skull bones. Joint between skull bones. Skull bones. And total, how many fontanelles there? Total 6 fontanelles are present. 6 fontanelles present. Which all are those? I will show in image. I will show the first fontanelles. This one is anterior fontanelle. This one is posterior fontanelle. This one is sphenoid fontanelle. That is both side present. And mastoid fontanelle. In number, anterior fontanelle 1, posterior fontanelle 1, and sphenoid fontanelle 2, mastoid fontanelle 2. Total 6 fontanelles. But during the physical examination of the newborn's head, we are able to palpate only 2 fontanelles, that is anterior fontanelle and posterior fontanelle. We'll see the difference between the anterior and posterior fontanelle. Here, anterior fontanelle, anterior and posterior. Anterior fontanelle is also called as bregma. Anterior fontanelle is also called as bregma, and posterior fontanelle is also called as lambda. The anterior fontanelle, it is in diamond shape, and posterior fontanelle, it is in triangular shape. And anterior fontanelle, it closes at 12 to 18 months, and the posterior fontanelle closes at 6 weeks. Closes at 6 weeks, or also called as a 1.5 month. 1.5 month. Okay. And fontanelles are some suture separated by some suture lines. Which all are those suture lines? See here, between the two frontal bone, this one frontal suture will be present, and between the frontal and parietal bone, that is coronal suture, that is present both sides, and between the two parietal bone, that is sagittal suture, and between the parietal and occipital bone, that is coronal suture. There is also number in 2. Both sides it is present. Between the parietal and occipital bone, lambdoidal suture is present. And we'll see the answer for our question, which fontanelle closes last. Here I mentioned anterior fontanelle closes at 18 months and posterior fontanelle closes at 6 weeks. We'll see the answer. Which one is the answer for our question? Answer for our question is anterior fontanelle. Option C is the correct answer for this question. We'll see the second MCQ. A 6-year-old drowsy child came in the emergency with the history of vomiting 3 episodes of loose stool for 3 days. On examination, sunken eyes, hypothermia, skin on pinching, taking 5 seconds to revert. And what is your diagnosis? Option A is no dehydration. Option B, some dehydration. Option C, severe dehydration. Option D, none of the above. Actually, what he asked in the question, the age of the child is 6-year-old drowsy child with history of vomiting 3 episodes of loose stool. Baby came to the hospital. Observed that on examination, sunken eyes, hypothermia, skin on pinching taking 5 seconds to revert. And actual question asked, what is the diagnosis? We will see the answer. First, we will see what is meant by dehydration. Dehydration means fluid loss from the body. Fluid loss from the body. And there are types of dehydration is present. according to the severity and according to WHO classification. We will see the according to the severity. There are three types of dehydration according to the severity. First one is mild dehydration, second one is moderate dehydration, and third one is severe dehydration. Severe dehydration. If body fluids losses 2 to 5% is, then we will call as a mild dehydration. If body fluids losses 5 to 9% is, then we will call as a moderate dehydration. If body fluids more than 10% is loss, means we will call as a severe dehydration. This one is the first type of dehydration. We will see the according to the WHO classification. According to WHO classification of dehydration, there are also present three types: dehydration, no dehydration, some dehydration, and the severe dehydration. In the no dehydration, there is no specific symptoms present in the no dehydration. No specific symptoms present. But in the some dehydration, the child is irritable, excessive cry, excessive thirst, and capillary refilling time between 1 to 2 seconds. And in this dehydration, urine output also decreases. We'll call as a oliguria. And there is no signs of hypothermia and cold of extremities not present in the some dehydration. We'll see the severe dehydration. In the severe dehydration, child is drowsy, lethargic, and urine output also fully decreased. It's less than 100 ml. Then we will call as a anuria. And capillary refilling time increases in the severe dehydration. It's more than 2 seconds. Severe dehydration, and extremities are cold. Extremities are cold in this. We'll call that one hypothermia. And we'll see the answer for our question. Actually, question asked hypothermia, synchronized, and skin pinching taking more than 5 seconds. I told this one in severe dehydration. Answer for this question is option C. Option C is the answer for the MCQ. We'll see the next question. Question number 3. A 10-year-old child weighing 30 kg is admitted for the observation. According to the Holiday-Segar formula, what is the appropriate daily maintenance fluid requirement for the child? Option A is 1200 ml, option B is 1700 ml, option C is 1800 ml, and option D is 2100 ml. In the case of dehydration, there are three plans we will use for the fluid replacement for dehydration child. In the plan, there are three plans: plan A, plan B, and plan C. This one, Holiday-Segar formula, it includes in plan B. We will discuss here plan B. Plan B. Mainly use plan B, we will use for some dehydration. Used for some dehydration. In this type of dehydration, we will give the loading dose for dehydrated child. Loading dose, we will see, loading dose is 75 ml per kg in 4 hours. ORS will administer, ORS administration. And we'll see the each stool replacement. How much will give? Stool replacement. Stool replacement will give according to the age wise. If baby's age is less than 2 years, then we will give the 50 to 100 ml per kg each loose stool. And if baby's age is more than 2 years, then we will give the 100 to 200 ml per kg each stool. Each stool will give the stool replacement therapy. We will see the C, that is maintenance dose. Actually asked in the question, this one, maintenance dose. Maintenance fluid maintenance fluid, it is also called as Holiday-Sagar formula. So many times asked MCQ on the Holiday-Sagar formula. We will see the in detail Holiday-Sagar formula. In the Holiday-Sagar formula, we will give the fluid replacement for 24 hours and hourly. First, we will see the for 24 hours. In this fluid replacement therapy, we will give fluid replacement according to the baby weight. First, 1 to 10 kg, 1 to 10 kg, 100 ml per kg fluid replacement we will give. In baby's weight 10 to 20 kg, first 10 kg plus first 10 kg means it's 1000 ml plus 50 ml per kg fluid replacement will give. If the baby's weight is more than 20 kg, more than 20 kg will plus first 20 kg weight, that's 20 kg weight fluid, how much will give? 1500 ml plus 20 ml per kg fluid replacement will give. For hourly we will see, for hour also same, there is no difference, little bit. 1 to 10 kg will give 4 ml per kg. Baby's weight is 10 to 20 kg, 4 ml first 10 kg means 40 ml, 40 ml plus 2 ml per kg. If baby's weight is more than 20 kg means first 20 kg how much we need? 60 ml plus 1 ml per kg will give the fluid replacement. In our question, weight given as 30 kg. Asked question 30 kg, Holiday-Sagar formula and fluid maintenance for child. We'll see that. I told you the first 10 kg how much? First 10 kg it is a 1000 ml. Next 10 kg how much it is there? 500 ml. And if more than 10 kg means it is a 50 ml per kg, 20 ml per kg, sorry 20 ml per kg, then it's a 200 ml. Total how much? It is 1700 ml. 1700 ml. Answer for your question is 1700 ml. We'll see in the option. For this question, option B is the correct answer, that is 1700 ml. We'll see the next question. What is the rate of increase in head circumference in the first 3 months of life? First 3 months of life, question asked, head circumference increases. How much increases? We will see. Normal head circumference, it's a 33 to 35 centimeter. Normal head circumference is 33 to 35 centimeter. How much increases? We'll see the first 0 to 3 months it increases 2 centimeter per month, and 3 to 6 months it increases 1 centimeter per month, and 6 to 12 months it increases 0.5 centimeter per month increases. In our question asked only for the first 3 months, of life. Here it is their answer. What I told, first 3 months is 2 centimeter per month. In our option B is the correct answer for this question. It is a 2 centimeter per month. We'll see the next question. Weight of the baby 4 times at what age? Option A 1 year, option B 2 year, option C 3 year, and option D is 4 year. How much normal weight of our Indian babies? Normal weight is 2.5 kg to 4 kg. 2.5 kg to 4 kg is the normal weight of the newborn. We will see when it is doubles, the weight doubles at 5 months, and weight 3 times at triples at 1 year, and 4 times at 2 year, and 5 times at 3 year, and 6 times at 4 year, and 7 times at 7 year, 7 times at 7 year, and babies weight 10 times at 10 year, 10 times at 10 10 year. We'll see the answer for our question. In the question asked 4 times quarter pulse at which age? Wait, quarter pulse of which age? Answer for our question is option B. Option B is the correct answer for this question, that is 2 years. We'll see the next question. Moderate hypothermia in neonate is defined as an auxiliary temperature of option A less than 34 degrees Celsius, option B 35 to 36.9 degrees Celsius, option C 32 to 35.9 degrees Celsius, and option D less than 32 degrees Celsius. We'll see the what is mean by hypothermia. Hypothermia means if body temperature is less than 36.5 degrees Celsius. Normal temperature it is 36.5 to 37.5 degrees Celsius. 5 to 37.5 degrees Celsius is the normal temperature of body. We will see the types of hypothermia. Types. There are 3 types of hypothermia is there. One is mild, moderate and severe hypothermia. Moderate and severe. Mild means temperature if less than 36, it's 36 degrees Celsius to 36.4 degrees Celsius will call as a mild hypothermia. If in moderate hypothermia means if temperature is 32 degrees Celsius to 35.9 degrees Celsius will call as a moderate hypothermia. If severe hypothermia means if baby's temperature is less than 32 degrees Celsius, then we will call as a severe hypothermia. In our question asked moderate hypothermia by the auxiliary temperature. What I told data that will according to the auxiliary temperature only. Answer for our question is moderate hypothermia means 32 to 35.9 degrees Celsius is the answer for our question. It is the option C. We'll see the next question. Surfactant production starts at age of, in which age surfactant production starts, like that question asked. We'll see the option A 20 weeks, option B 32 weeks, option C 28 weeks, and option D is 36 weeks. What is meant by surfactant? Surfactant means it is a chemical substance. In the surfactant mainly two are present, that is phospholipids and proteins. Phospholipids and proteins present. Mainly phospholipids, there are two phospholipids. See, phospholipids. There are two phospholipids mainly. One is lecithin and another one is the sphingomyelin. So many times asked a question, what is the ratio between lecithin and sphingomyelin? Mainly lecithin, maximum in amount lecithin will be present, and the ratio of lecithin and sphingomyelin ratio is 2:1. 2:1 is the lecithin sphingomyelin ratio. Surfactant produced by, you'll see the important points. Surfactant produced by type 2 pneumatic cell, or it is, we can also call as type 2 alveolar cells. Type 2 alveolar cells. And surfactant production starts in the fetal lungs. Starts at which is in the 20 weeks fetal production. The fetal surfactant production starts and completed at 35 weeks. Completed at 35 weeks. And we are able to find out surfactant in amniotic fluid. In amniotic fluid at age of gestational age of 28 weeks, we are able to see in amniotic fluid. The surfactant is a very helpful for reduce the that surface tension of the lungs. It will prevent collapsing of lungs or alveolar cells, lung alveolar cells. You'll see the answer for our question. In the answer asks surfactant production at which age? Starts at which age? Our question answer is option A. It is a 20 weeks. Like this only important MCQs we will discuss in the next session. Thank you very much.